Are you a golden retriever, a wallflower, or a bold beginner? It's okay if you have no idea what that means, because today we are breaking it down. Today we're talking about the 3 most common personality types that you will see during your clinical rotations, or maybe even in the mirror. We're going to unpack how each one can shine, where they might clash with other personalities, and how to flip any potential awkward moments into a confidence-building win. This is the Nursing Navigator.
Nursing Navigator's here. Wipe away those study tears. Hurst Review's got your back. Listen close, stay on track.
Ashley, within the first 30 seconds of meeting somebody, healthcare professionals especially have already formed their opinion on them.
Especially at clinical, because, your clinical reputation is being formed, and it starts even before you say a word. Like, it starts the second that your feet hit the floor.
Personalities. Everybody has one.
Yeah.
Or
some.
Multiple.
Yeah.
But I think it's important to be aware of your personality and how you are presenting that in clinical, but more importantly, how others can be perceiving your personality, because it goes beyond thoughts, feelings, behaviors. You're impacting others, whether you realize it or not. So we want you to be aware of this. That way your reputation can work for you and not against you in a clinical setting.
Yeah. 60% of nursing instructors say that they have gauged a student's professionalism based off of their body language before they ever even try to perform the task. So It's really based on the way that they have presented themselves with their body language first. They're judging and gauging that student's professionalism or level of professionalism based off that, and not the actual task that's at hand.
Have you caught yourself doing that?
Oh, yeah.
Looking back?
I think that I have formulated an opinion about that student's personality. I formed my first opinion about that student based on their body language.
And that's important, because when you have that opinion that's already formed, it's really kind of hard to sway people's opinions when they've already had their mind set up to something.
Yeah.
I love those examples that you just kind of threw out. And we gave them names. Yeah. We are calling them the golden retriever, the wallflower, and the bold beginner. You kind of already introduced them. So we have our golden retriever. They're early. They're upbeat. They're ready to jump in. And they have that, I want to help energy.
Like, poof, what do you need? Poof, what do you need? Yeah, right there.
So we've got a golden retriever. We have a wallflower. They're the ones that maybe keep their head down a little bit more, and they don't want to be in the way. Yeah. Sometimes they may feel like they're being overlooked, but they radiate this I want to observe energy. And a lot of times that's going to be based more out of fear, because they don't want to do something wrong. That's right. Not because they don't want to help. They just are afraid of doing something wrong. Yep. And then the third student that we're going to meet today is the bold beginner. Oh, they walk in like they've done this before 100 times.
Yep. They know it all.
They've
got all the info.
Maybe they've had some experience in a healthcare environment in the past, but sometimes they give off this, I got this energy. You want to start with the puppies?
Yeah, let's start with the puppies.
Okay, here we have the golden retriever. What are the pros that a golden retriever brings to a clinical setting?
Well, first, they have so much energy and excitement that they bring a lot of positivity. And that excitement and energy really kind of drives the momentum for the unit. So that's always good. You want good energy and good movement on the unit, so that way the time goes by. They also tend to have really good relationships and build rapport really easily with the people that they are there with, their classmates, their instructor, the other nurses on the unit. So that's always really fun.
They're everybody's friend.
Yes, they are. They're everybody's friend. And they're happy to be there, and they're there to learn, and they want to learn. So they really show an interest in what's going on, what can be taught. Is there a new skill going on in the room? They want to be in the room.
I feel like that would be really welcomed by
yeah.
the instructor. They know that they have somebody who's eager, who's friendly, and who wants to help out. But I'm sure that the instructors also has a little bit of maybe cons. We got pros, we got cons
Yep.
of this energy that is being brought in. So what should these golden retriever students be aware of?
That's right. So sometimes if you have that much energy, you're not aware of any time that you're overstepping. Is that there are certain times that you're, stepping into certain situations and you're so eager that you're not waiting to be led. Like you're jumping and you're like, yeah, I got this. It's like, oh, I'm so excited to be here. I'm going to do this. And it's like, what are the instructions? Have I been given the opportunity to be told, yes, now it's time. Sometimes we kind of just overstep when we have that high energy. So overstepping can always be an issue.
So how can we take the overstepping and turn it into something that could be beneficial?
Ask first. Take that energy and say to your instructor, hey, is there anything that I need to do right now? Is there anything that I can do right now? If there's a nurse there that has, something that needs to be done, ask. I would love to be able to do this with you. I would love to be able to learn more about this. Can I do this? Can I go in the room with you? Can I be present?
That's great. So we're channeling that energy and that excitement into awareness, but also permission.
That's right. We also see that they have a tendency to interrupt.
Guilty.
It happens.
But it's like, I have something to say about this.
Right. And it's sometimes even maybe a fear that they're going to forget to say it later,
Guilty.
right? Like I got to say it right now because I'm going to forget to say it. But when we interrupt, maybe we're interrupting the person that is talking at that moment, their train of thought. And so if it's an instructor or a nurse or maybe even the patient, because sometimes they get so excited about something that's going on, they're interrupting the patient from responding to the nurse. And so we have to be really careful with that too. So this is one of those seconds where you pause, okay, and you think, again, ask yourself a question. Is now the right time to ask?
So we have practice, that intentional listening. We have patience to maybe step back and jot down a note to ping a reminder to yourself. And really, I think like it's the permission part too, which leads to professionalism.
Yeah. But that's wonderful because in nursing school specifically, and in the nursing profession, but in nursing school specifically, that is one thing that we're taught from the very beginning is that it doesn't matter how much experience you already have. It doesn't matter if you are a tech, a CNA, if you've got some type of medical experience. As a nursing student, you have none. Like we're pretending like you know nothing and we're jumping from there and you do nothing without permission first because permission is professionalism in nursing school. There's one other thing that we sometimes see. And again, that just ties right back into having that energy and that willingness to learn and do is that sometimes they take over. Like they just take over the task and there's a willingness there, but there's not always a knowledge. And so like, yes, they want to do it and they want to know and then they get stuck. And we're like, wait a minute, we could have walked through this together or we could have watched one and then done one together. And then you do one, by yourself while, once you've been given that permission. But that happens a lot of the times. And so we want to be really careful with just, jumping in and overstepping on those tasks. And so one of the ways that we can kind of, help ourselves with that is, again, that ask. It's like, hey, may I do the next one? Or if you're looking for somebody to do this, I'd like to go first. Or, just, again, asking.
Yeah. Maybe you're having a hard time picturing what these personalities look like in a setting. So we have a little awkward moment here to read to you to help kind of put some pieces together of how this could present. This is the awkward moment segment for the Golden Retriever personality. The Golden Retriever spots a nurse heading into a room and shouts, "I'm coming to help." So they barge in without gloves, without permission, and the nurse is mid-wound care. The nurse freezes, and then the patient looks up and asks, "Who are you?" The instructor gives the slow head turn nod and says, let's talk about boundaries.
Yep.
Has this situation happened to you? Have you seen it happen to some of your classmates and your peers? If so, encourage them to come and listen to how they can turn those cons into those strategies to set them up for success.
That's right. And there's a question, I think, like we need to think about a question is, what if all of our enthusiasm, that great enthusiasm that we have, what if that could make us the most trusted student in our class, in our clinical group, versus the one that everybody's always side-eyeing? You know, like they're always like, versus if they actually really trusted you because of all of that you have.
Actually, let's answer that question next week.
Yep.
Because we're going to talk about how we can use these strengths during our clinicals and use the personalities that we have to our advantage to land that job, to become that trusted employee, that trusted nurse, and to help you succeed in your career. Then we have our bold beginners. What are some other pros that we see when it comes to the bold beginner personality type?
There are some really good things about this personality type because we want all of these different personalities, especially at clinical. And so some of the things that I notice in them, they do have that confidence. And we want a confident nurse.
Yes.
Okay. We want a confident nurse who knows what they're doing, that is sure of themselves, and they bring that. And so that's always a good thing. They also are very comfortable with staff. They're comfortable with processes. They're comfortable with the people, the patients, because they are so familiar with that environment. And then they also take ownership. Like they take ownership of their learning experiences, which is why it's also sometimes so very easy for them to say, I already know this. I want to move on. Like I want to move on to the next thing. So that ownership, that confidence that they have, and that comfort level that they have with people and the unit is wonderful, because we sometimes want to have students that walk in that are aware.
Mm-hmm.
You know, it's sometimes nice to have a student that's doing clinical at a place they used to work as a tech. You're like, here we are for nursing, and you used to be a tech here? Great. You can tell me where stuff is.
Yeah, and you're comfortable with them.
Right.
And I think that when it comes to clinicals, a lot of people are so intimidated by it that they let that intimidation rule and kind of take over.
Yep.
So to have this bold beginner walk in and have that confidence can be really refreshing.
Right.
There's a difference, though, between confidence and cockiness.
Yeah.
And wanting to be a confident nurse versus a cocky nurse. So let's talk about a little bit of how this could present in a negative light, and then we'll go through the same path, just like we did with the golden retriever, and talk about how we can take the things that could be perceived as a negative and spin them into how you can use it to your advantage.
That's right. All right. So sometimes with the bold beginner, cockiness is actually just an overconfidence. And we don't want to be, overly confident and appear that way. We want to stay teachable. So the way that we tackle this is we remember that if we stay teachable, that we're staying safe. And if we're staying safe, the patient is staying safe. And that's the ultimate goal.
Yep.
The ultimate goal is patient safety.
Always bringing it back to safety.
Always. And so this kind of goes back into something that we did talk about with the golden retriever, is that permission. That asking for and waiting for permission. Not moving ahead to the next thing just because we know this one thing already. Just being patient, asking for that permission, so that way we can keep everybody safe.
And be a good team player. Right? Because if you already do know how to do this, and your instructor is going to know, the nurse is going to observe that very quickly on.
Yeah.
But nursing is a team sport.
Right.
We've talked about this. So it's important to make sure that your other team members are being brought up to speed. And maybe you can ask permission.
Yeah.
Is this something that I can help with, or do I need to take a step back here?
Right.
So that's a good one. Emphasis on the overconfidence.
Yeah.
Could be a little bit tricky.
Right.
But we can ask the permission.
And so we kind of want to be aware of that. We talked about nursing being a team sport. We want to be a team player. And one of the best ways for us to practice being a great team player is don't be dismissive. Hey, it's so sometimes so hard, right? Like you know something and you know it. And you just like somebody else is talking and you're like, that's not right. And you want to dismiss their comments or their strategy on something. And so we just want to make sure that we're not being dismissive. And so some ways that we can work on that is, let's say your teacher gives you a question or a scenario. Don't speak first. Don't speak first. Like, give other people an opportunity.
We already know the golden retriever is going to just speak first.
That's right. Like, you don't have to worry about it. They're going to jump in. Our sweet puppy friends are going to do this for us. Okay, but when they do, don't dismiss them, right? Because they may be loud and wrong. Like they were wanting to help. But don't dismiss it automatically. Maybe ask another question that re-triggers their way of thinking. And that's such a respectful way to get involved in the conversation without being dismissive of what they said. And then, offer advice as you go and offer help.
We've talked about communication before,
sure.
And there's a certain humility that you can bring into the communication setting in a clinical setting because you are there to learn and to learn in a safe way.
Right.
That way you can practice safely.
Yep.
So sometimes it could be like, would it be appropriate to? If you already know the answer is yes, it's just how you present this.
Yes.
Would it be appropriate to fill in the blank?
Yeah.
Would you be willing to fill in the blank?
Yeah.
And that's one way that really you can kind of flip how it could be perceived as a negative into, wow, that bold beginner over there really wants to help and they know what they're doing and they're being a good team player.
That's right. They're not using their experience as a weapon. They're using it more as a tool.
Yeah.
Which is
powerful.
Yep. But I think the main thing to remember here is because, again, a bold beginner is one of those ones that they typically just do it. Like they want to start. They're an easy self-starter. They don't need people to encourage or motivate them to get started. But the issue is that if we're not waiting for the permission to do something, then we're going to cause problems. And we have to remember that even if we've got some type of medical experience, when you go to clinical as a nursing student, you don't have any of those things. So if you're already a CNA, you're not working on your CNA license at clinical as a nursing student. You are utilizing the license of your instructor and the licenses of all of the nurses that are on that unit. You are not a licensed professional in that environment.
That's high stakes.
Yeah, it's very high stakes.
Everybody around.
It is. And I think if we keep that in mind too, that's so helpful, is that I'm not working on my own license, that I'm here as a student and I'm protected. Too, there's a safety in being the student. Is let them protect you.
Yeah.
Yep.
We talked about permission quite a bit. Is there a difference between permission and supervision?
Yes, absolutely.
What does that difference look like? And when do we want to favor one over the other, or is it always we use both?
Typically what happens is that you've got an instructor that has seen what you've done. Like they've had the opportunity to supervise you in certain things. And in most situations, that's because they've told you, let's go do blank, blank, blank. You didn't typically ask. They have told you, let's go do this. Or they've observed you in lab do this a million times. And so there are lots of times where you're going to be performing skills with someone else. And in most situations, at clinical, you will be performing skills with someone else. And that person that you are performing it with has a license, right? But then there are times where they've watched you do vital signs a million times. They will send you off to go do vital signs alone with no supervision. But it's only once you get that permission to do that you want to be able to just go. Otherwise, you need to ask first. Once they've given you the green light, then you're free to go. But if they've never given you that green light before, ask. Like you always want to ask. So there are some skills like vital signs, sometimes head-to-toe assessments, and a few other things that once your instructor has seen you do a time or two, you might have been checked off on those in lab. They will send you with no supervision to do those. But anything else, you're probably thinking, I'm going to be supervised while I'm doing this. A Foley catheter, starting an IV, doing anything invasive, most likely with supervision.
And we know it's all about safety, right? And when you're being supervised, you're probably making a more conscious effort as a student to be extra safe because I have somebody watching me.
That's right.
And it leads back to this 2023 review that was done on clinical training programs, which reported that unsupervised student interventions were linked to a 1 in 5 reported safety incident, most of which were preventable.
Yep.
All that to say, if somebody is coming in and supervising you and you are a bold beginner and I know how to do this, I've done this a million times, I've been given that permission, why are you looking over my shoulder? It's their job.
Yep.
And it's okay to ask. It's okay to welcome that feedback in because we're trying to improve those communication skills as well.
That's right.
We've got a situation for this one too.
Oh, goodness.
Cue the awkward moment for the bold beginner. They stroll into pre-conference, drop their bag, and say, vitals? I've done those like 100 times. Then they try to take manual blood pressure with the cuff upside down. Their instructor gently corrects them, and the student gives a blank stare and says, I've done it differently. The whole unit kind of swaps those glances, and then it's just a very long, awkward millennial pause as they tried to turn less red. We're dramatizing this for you just so you can help kind of picture, maybe I have done XYZ before, or maybe I have presented this way, or so-and-so presents this way all the time and it drives me nuts. Well, maybe they just haven't listened to this episode and they don't know how to kind of turn those strategies into ways to make them shine. So could your confidence end up being your greatest strength? It very well could be.
Yeah.
Maybe you just need to add in a little humility, a little bit of patience, and a little bit of strengthening those communication skills, and you have a whole new toolkit to work with. Then we have the Wallflower. I feel like this would be me. It's like a little timid, not because they're like intimidated or anything. It's just they kind of want to stay out of the way. They don't want to cause any problems. And they maybe just don't want to do something wrong.
Right.
How can this be a positive personality trait in a clinical setting?
This student is so respectful. Like, they have such a respect for boundaries and space. They understand that safety is key. And they want to be safe. And their fastest way, and the way that pops in their mind to be safe is to be in the background, to not be in the way. They also have a great respect for nurses and the work that they do, and they want to be them. So they understand that that's vital. They're really good listeners. They like to take the notes. Like, they're really good at the note-taking part. So they've picked up on everything that's been going on in the unit. If you've got a question, they're a great person to ask. But you have to ask them. They won't offer it.
They're not volunteering.
No, they're not going to volunteer it, And so these are all really good things. Like, these are also qualities of a nurse. And I think that if we pay attention to it, everybody that we've talked about with those pros, those are all qualities that we want to see in the nurses that we encounter. And so none of these things are bad. Like, these are good things.
What are maybe some things that the other nurses or instructors or even my peers are picking up on that could be perceived as a negative?
Well, first, they might not have even picked up on anything because you were easily so overlooked.
Yeah,
they may not have even known you were there. Right. Like, oh, hello, who are you? And you'd be like, I've been here the whole time. Like, you were so quiet. I don't know. And so sometimes they miss you. Like, you're so easily overlooked because it's like you're kind of in the background. And, when it comes to nursing, especially clinical, you need to be in it. Like, you've got to be there, like to be able to be asked to do something. And so, we want to try to shift that. This comes with speaking up every now and then. Like, let your presence be known. And you don't have to do that in a disrespectful way. I know, this student who finds themselves being the wallflower, they are so respectful and they think if I'm just out of the way and if I'm quiet, then I'm good. But say something every now and then.
Yeah, actually, I think there's a lot of power in that because you have the people that, quite frankly, won't shut up.
Right.
Do you want to know how often they're actually being listened to? Because they're just all the time. But then the power that you hold, if you aren't one just to always speak up and chime in, but when you do, the weight that carries is just like, be quiet and listen. She's talking. What do you want to say? Everybody listen in.
Right, because you've been thinking. Yeah. You've been brewing that conversation, and it's always on point too.
It is.
It's always on point.
I think if you are a wallflower, you should know the power that comes of I've been observing, I've been taking notes, I've been listening, and I've been reading the room. And this is what I'm going to say. That is so powerful.
Yeah. Because everybody's head is going to turn the moment that your voice comes out. They're like, I didn't know it sounded like that.
Exactly.
Yeah. And so another one, and it kind of stems from the first one that we covered with the wallflower, is missed opportunities, like missed learning opportunities. If the nurse doesn't even know that you're there, like if they've overlooked you and they're like looking for someone to go and take into a room to go, hey, let's go do this. I'm about to go do this. Oh, the primary healthcare provider's coming in and they're going to do this. You're going to miss that. You're possibly going to miss that unless, you've been paying so much attention, you just walk behind everybody. But they're probably not going to grab you, because you're hanging back. They're probably not going to bring you into that. And so you want to be able to be brought in. And this doesn't require much. This goes right back again to saying something. Like saying something. And you don't have to talk a lot. Just a little bit.
I think it comes down to just the principle of active participation. We know that students who are actively engaged and actively participating, they retain 40% more clinical knowledge than those who remain a little bit more passive. And this is exactly why we teach the way that we teach at Hurst Review. Whether you're on the online session, an in-stream, or in person, we really have structured our curriculum and like our teaching process to have that engagement. Nobody just wants to sit there and listen and listen and listen. They want to contribute. And we know that that contribution and that active participation and engagement leads to better retaining that knowledge so you aren't missing out on those opportunities.
That's right. And so sometimes the biggest issue, and I think out of all of these, this might be the biggest one, is that, how we talked about earlier about body language and that 60% have already determined your professionalism based on your body language, is one of the things that can happen with the wallflower is that they perceive you as uninterested, disengaged. You don't want to be there. And that's not true. And we know it's not true, but it appears that way. And so if you're disengaged, they're not going to bring you in. There's not much that they're going to want to be able to show you, provide to you. And so we don't want to, have anybody thinking that we're not into what's going on.
Yeah, and I feel like body language probably gives a lot more weight to the wallflower if they are a little bit more quiet and more reserved.
Right.
So what is your body language saying about you? As a nurse, as a student, in the clinical setting? You can still be quiet.
Right.
And you can still kind of keep to yourself, but are you carrying your notebook around?
Right.
And maybe you're not speaking the most out of the group, but you can be taking active notes. You can bring it up in your post-conference.
That's right.
You can kind of pull the nurse or the instructor aside, and maybe you don't feel comfortable being the loudest one in the room. We don't want to change who you are. But that body language tool, I'm so glad that you brought that up because it is a big factor and maybe a bigger factor for our Wallflower personalities.
That's right.
That making your presence known, stemming from being easily overlooked. If this is you, please tune in next week because we're going to give you some really good tips on how to use those strengths to make your presence known without having you change your entire personality because that's
right.
what we don't want to do.
Right. There's so much power in those positive qualities of a wallflower.
Yeah.
And so no, don't change. Don't change. Let's just add some things.
Yep.
Yep.
Okay, let's see what this little awkward moment for the Wallflower looks like.
Oh, goodness.
Okay, the Wallflower is assigned to room 204, and they spend the morning quietly observing, careful not to interrupt. During the huddle, the instructor asks, "Can someone share what they saw in room 204?" The Wallflower looks down, hoping that somebody else speaks, but there's silence. The instructor gently says, "Hey, Wallflower, weren't you in there?" They nod. That's all. The nurse adds, "They were super respectful, and I think that they understood it all because they didn't have any questions." Then the Wallflower smiles nervously and says, "I actually had so many questions, but I didn't want to bother anybody, so I can bring them up later." The instructor smiles and says, "Next time, bother us. That's how you learn." So being quiet isn't always a bad thing. Maybe that quiet nature that you have in yourself could make you the most trusted nurse and one that people are not going to forget or overlook, but one that they know that they can go to be listened to, respected, and heard. Trust is a big thing. So which one are you? Are you a golden retriever, a bold beginner, or a wallflower? Maybe you're a little bit of both. And maybe you're one at one point in your career, and then you evolve into the other, and you can kind of pull bits and pieces from each one. But that's the beautiful thing about personalities.
Right. And there's no, one size fits all personality. It's really more about how you let these personality types work for you and not against you.
I have a challenge for you, though. Before your next clinical, whether you're in it now or you know that it's coming up, I want you to ask yourself these questions. Am I showing up with intention? Am I building trust, or am I just blending in? Am I letting my strengths shine, or am I letting my nerves take over? Because your clinical reputation, remember, starts the second you walk in. But the best part is you get to shape it day by day, shift by shift. We'll see you back here next week to talk about how these personality groups can help impact future employment opportunities and how you can use them to build your leadership skills. Until next time, future nurses,
Current nurses,
and retired nurses, thanks for tuning in to the Nursing Navigator by Hurst Review.
Guiding you through from school to the floor, nursing news, careers, and so much more. Learning, growing, passing the test. With Nursing Navigator, you'll be your best. Nursing Navigator's here.